Hi, my name is Dennis with the Division of Care and Treatment Service, and today we're going to review the steps on how to respond to an opioid overdose. The first step in responding to an opioid overdose is determining whether the person is responsive or not. Signs of an opioid overdose present with non-responsiveness, pinpoint pupils. There could be possible vomiting present. The main element of an opioid overdose is that the individual be non-responsive. You can determine this by utilizing the shake and wake approach. Shake and wake is taking the individual firmly by the shoulders, giving them a shake, and saying their name.
Jennifer. Jennifer.
The main thing you want to determine is the non-responsiveness. If the individual is not responding to you saying their name or shaking them, it's safe to assume that this is an overdose. Once you've determined that this is an opioid overdose, we recommend calling 911. 911 gets first responders and medical help on the way immediately. The state of Wisconsin offers limited immunity to anybody helping and assisting in the event of an overdose. Limited immunity means protection from any personal paraphernalia or substance that you may have on your person or that the overdose individual may have on their person. Limited immunity does not offer protection against any warrants or other illegal activities that may be occurring. Another reason for calling 911 in the event that it's not an opioid overdose and there's another medical emergency involved with the person's non-responsiveness, it assures that medical help is on the way. After calling 911, the next step is to check the person's breathing. Are they breathing or not? If they're not breathing, you're going to need to do rescue breathing. Rescue breathing is a critical component because every minute without oxygen, chances of revival decrease 10%. Before performing rescue breathing, you want to check the individual's mouth to make sure that there's no foreign objects inside the mouth. Nothing that could be blown in and block the airway permanently. You simply check the mouth by opening the mouth, sweeping the finger along the gum lines, look for any foreign objects that shouldn't be in there. Some things that might be found in an individual's mouth in an overdose situation may be the cap from the syringe, a substance packaged and stashed in their cheek. It could be a piece of gum, it could be a piece of food. So be sure there's nothing along the gum line, under the tongue, or in the back of the tongue before you begin performing this step. To perform rescue breathing, lay the individual on their back, tipping their head back. If you have a breathing barrier, you may place the breathing barrier over their mouth, pinching their nose, and then give one breath every 5 seconds. Continue this for 30 seconds. One thing to be mindful of when performing rescue breathing, there is the risk and chance that the individual may end up throwing up. Not all the air is going to go into the individual's lungs when you perform rescue breathing. Some of that air is going to go down the esophagus and begin building up in the stomach. If this is done long enough, that air is going to come back out, and anything that's in the stomach is going to come back out with it. If that happens, stop and go back to the step of checking and clearing the airway again. Upon performing rescue breathing, the next step is to administer naloxone. There are 3 forms of administration to get naloxone into an individual who's experiencing an opioid overdose. We will demonstrate all 3 forms. The 3 forms of naloxone administration are auto-injector, intramuscular, and the nasal unit. If you have an auto-injector unit, the auto-injector is designed to talk you through the process.
If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
Intramuscular, or IM, is another route of administration. This requires the use of an intramuscular syringe and a vial of naloxone. The first step in this process is opening the syringe first. One thing I always recommend before pulling the cap off of the needle is to give a little clockwise twist to assure that the needle is firm within the syringe barrel. Sometimes from just climate control differences, the expansion and contraction can contribute to the needle being a little bit loose in there. So giving it just that little check twist to be sure that the needle is securely screwed into the barrel before removing the cap. Remove the cap from the syringe. This vial is 1 dose of naloxone. There's a cap on top of the vial which needs to be removed, which is simply done by popping the edge of it with using your thumb or finger. Now that the top is removed, there's a small diaphragm in the top of the lid that the tip of the needle can be pushed through to draw the naloxone out of the container. I found the easiest way to do this is to pull the plunger back on the syringe, insert the tip of the syringe into the naloxone, turning the vial upside down. I'm going to push the air from the syringe into the vial, and by doing that, it automatically, the air is going to push the naloxone back into the syringe from the vial. I'm going to push the little bit of air that's in there. And now the syringe is prepared, ready to administer the naloxone. To administer intramuscular naloxone, you can go right through the clothing, through a jacket, shirt, pants. You insert the needle into any muscular area like the shoulder, the thigh, or the buttocks. And the other route of administration is the nasal unit. The nasal unit is simply opened by peeling the foil wrapper back, removing the nasal unit from the container. The nasal unit is used simply by holding it between the middle finger, index finger, and thumb. You can see the injection portion is between my middle finger and index finger, and my thumb is on the plunger, which will be depressed for dispensing. Insert the unit into the nostril until the edges of the finger touch the outer edge of the nostril, and then press with your thumb. If 2 to 3 minutes have passed and the individual is still not responsive and 911 has not arrived on the scene, you'll need to administer another dose of naloxone. Repeat the administration of naloxone every 3 minutes until the person regains responsiveness or until 911 shows up. One more important thing to consider: even if the individual is responsive, alert, breathing on their own, stay with the individual because the naloxone can and will wear off within 30 to 90 minutes. After you've administered naloxone, if the individual is still not breathing, continue following the rescue breathing steps. If the person's breathing and still non-responsive, place the person in the rescue position. Placing a person in the rescue position is achieved by crossing, for example, a left arm and a left leg across the body so they can be rolled onto their right side with their right arm over their head and their right leg straight. This position allows the individual a safe recovery position in the event of any vomiting and reducing the risk of choking. An important bit of information to be aware of and have knowledge about is what are some of the opioid overdose factors and contributors. If you're taking opioids for medical or non-medical reasons, don't use them alone. If you overdose by yourself, no one will be there to help you. Having a reduced tolerance contributes to opioid overdose. Reduced tolerance occurs when the opioid is no longer being taken. This can occur in settings such as jail, treatment, sobriety, recovery. Another overdose risk factor is unknown purity level. This is specific to unprescribed opioids. Purity levels of heroin on the street today can range anywhere from 15% all the way up to 60% pure. And there's no way for the individual to know exactly what those purity levels are. For example, if I'm a street user and I get the same connection every time, maybe that purity level is 20%. I don't know that. I just know that it's consistent. I use the same amount every time. Going from one connection to another connection could be the difference of getting something that's 20% pure and something that's 40% pure. And without knowing what that purity is, that's how easy it is to double my dose without even knowing it and exceeding my tolerance level. Another risk factor for opioid overdose is mixing your opioids with other downers like alcohol, benzos, antidepressants, all increase the risk of an overdose. Opioids already do the same thing as alcohol or benzos. They're all depressants that slow and depress the respiratory system.